Well, it's Mental Health Awareness Month, and according to Mental Health America, nearly 50 million Americans experienced some form of mental illness in 2022. And joining me now is Dr. David Spiegel, professor of Psychiatry and Behavioral Sciences at Stanford. To start off with, thanks for joining us. What are the differences between anxiety disorders and mood disorders?
Anxiety disorders are the kind where you feel agitated, worried constantly, worried beyond what the actual situation might trigger. About 1 in 5 Americans, so more than 50 million Americans, suffer from anxiety disorders. Depression is in some ways the opposite. You feel down. You sort of feel hopeless, helpless, and worthless. You have low energy. So people with anxiety are, if anything, excessively agitated. People with depression are down and have trouble mobilizing themselves. And depression is the single most common cause of disability, of time away from work in the world.
Oh, interesting. So what are the causes of depression and anxiety?
Well, a lot of it is social stress. Lord knows we've been through enough of that in the last few years. So social isolation, financial concerns, worrying about being able to get your job done, worrying about family members getting sick or dying from COVID or other problems. And that makes a lot of people anxious. And our social contact is a way of soothing ourselves, of getting to see people who we know and like and who comfort us and we comfort them. And that's been interrupted by the pandemic. Depression comes from feeling that you're failing, that you're not making it and you can't make it. People exaggerate anxiety. People who are anxious exaggerate what they're worried about. Depressed people exaggerate any negative thing. You tell a depressed person 9 good things and 1 bad thing about themselves, and they'll remember the bad thing. And that, in some people, can lead to thoughts or even attempts at suicide.
And you talked about the pandemic and the impacts that had on us. As we're making our way out of the pandemic, do you see the hope for some improvement in a lot of people's mood and anxiety and depression?
Well, I sure hope so. I think having more normal social contact, being able to get out and around, and frankly, being less worried that you're going to catch COVID if you get near some stranger that you don't know, I think should help people. At the same time, we were all facing new challenges now about getting our lives back on track. So it's important to get help. There are psychiatrists, psychologists, physicians available to help people. There's more and more online now, ways of connecting with therapists or participating in apps that can help you learn techniques to manage your anxiety, to separate your physical stress from your mental stress, because they tend to reinforce one another like a snowball rolling downhill. So there are things you can learn from good mental health apps that can also help you handle your anxiety and depression better.
Well, here's hoping we get to see that improvement as we come out of the pandemic. So Dr. Spiegel, always good information. So thanks for joining us.
You're most welcome.